Okay. Good morning, good evening, good night, doctor, nurses, and pharmacists. I am Dr. Che, and today we will discuss very important OET writing tips. We have these case notes. These are my own case notes. We will discuss how to write a letter, all the important things, and we will try to write a letter also. Okay. We will see what is important, what is not important, which type of letter this is, how to organize, how to write purpose, how to write conclusion, all of these things in today's class. Okay. So before we start, just I want to ask how much time will you have in the real exam to complete your task? Anyone? How much time will you have in the real exam to complete your task?
40 to 45 minutes.
40 to 45 or 45 or 40?
5 minute reading time and 40
Mm-hmm.
minutes for writing.
Okay, very good. Okay, 5 minutes reading time and 40 minutes to write your letter. What you can do in these 5 minutes reading time?
We select the points like the necessary points like need, social history, need main points right in the letter, and which point is not right
Is
in the
good.
right.
So in these five
Actually,
minutes, you will only be able to read your letter. You will not be able to write or underline or anything. You will not be able to have your pencil in your hand. Okay. You will just have your question, these case notes in front of you, and your answer sheet in front of you, but you will not be able to write anything because you will not be allowed to pick your pencil. Okay. So what you can do in these 5 minutes, you will quickly read your letter, quickly read and plan in your mind how you are going to organize what you will write in the purpose, which type of letter this is, how many paragraphs you are going to write, which information is relevant, which information is irrelevant, all of these things. Okay. And plan how many paragraphs you are going to write, what you are going to write in the purpose, what you are going to write in the conclusion, which information is relevant, which is irrelevant. Okay. And in the next 40 minutes, you will be writing your letter on the answer sheet. And in this time, you will, in this time, you will proofread also. Okay. So now today we will discuss this letter. We will try to write like a real letter. Okay. So you will learn a lot of things. So first of all, whenever you get a letter in front of you, just quickly read one or two things from the surface here, and then go to the where.
from the bottom.
No, to the task, okay? Go to the task, okay? So just this
Okay.
is time and assume today's date is you are a doctor or nurse at this hospital. Read the notes below and write the task and complete the task. Okay. Let us go to the task. If
It
you
is
read the
read like
task, it says using information in the case source, write a letter. Even you need to see the diagnosis. This is discharge plan. And if you see assessment here, this is snake bite neurotoxic, okay? Sometimes they write assessment and the final diagnosis here also. So in the case note, in the writing task, they say using the information in the case notes, write a letter to Dr. Che, patient's family physician, for further care and follow up. Okay. So you are writing this letter back to patient's family physician. Okay. So
Assalamualaikum
here,
sir.
Walaikum Assalam. So here, details of the family physicians are given. So this is Dr. Che, general physician, Braxton Family Clinic. This is the address and this is the name of the city. Okay. So what comes in your mind after reading this writing task? What comes in your mind about this letter? Can anyone explain me?
Excuse me, sir, if you don't mind, I would like to take your few minutes
Yes, please. Yeah.
before class.
Yeah.
Assalamu
Yeah.
alaikum, everyone. I'm Dr. Kausar, and today I'm going to share my experience with Dr. Che. Dr. Che is really a amazing teacher, and his way of teaching is really fantastic. So, any one of you who is having trouble with writing parts, I would recommend to take his classes. I would like to share my experience because I appeared twice for this OET exam, and each time I got 320 scores.
Two
I
times. You
took
have taken OET
classes from,
already two times. Yeah.
yes, and each time I got 320 score.
In writing.
And I used to take yes, sir. And I used to take classes from many tutors and even benchmark as well.
Hmm.
But no one guide me properly. No one point out my mistakes where I'm going to make a mistake. But Dr. Che helped me a lot. He point out my minor mistakes, and due to his classes, this time I got 420 marks in
420 from
right.
320 to 420.
Yes.
100 marks
So
improvement. Yeah. Even I got
yes,
in the
sir.
real exam, I
So
got
I would recommend.
400. In my real exam, I got 400, but you got 420.
Yes, sir. Sir, because of your classes, I got
Uh,
420. But I was shocked when I saw my score, but it's just because of your effort. So I would recommend anyone who is having trouble with writing. So instead of wasting money and time here and there, I would recommend to take your classes to get your desired score.
Thank
And
you
I
so
would like
much.
to
So this
thank
is
you
a
again.
thank you again. So this is
Thank you,
a
sir.
real
Thank you, sir.
feedback. So you people, as you know, I don't tell any lie and I don't make any fake, feedbacks. So she joined my classes. Even I got today a message of someone who told me that she has recommended you to join my classes. I don't remember the name. So someone referred you for my classes. I think so. She told you about the class.
Yes, sir. Sir,
Okay.
I would recommend everyone who is having
Yeah,
trouble to
thank you.
take your classes.
Thank you so
Thank
much.
you, sir.
Thank you.
Thank you.
So if anyone wants to join our writing classes and speaking feedback also, so you are welcome. And nowadays we have special discount. Even you have seen that in today's task. Okay, this is my special course, VIP hybrid course, and this is the course which she joined, and she got 420 after joining this course. Okay, so we were discussing this letter. My way of teaching is I just prefer individual one-to-one teaching. Okay, so this is different from other tutors. Okay, so after reading this letter, what comes in your mind? So what comes in our mind is number one, this is a discharge letter. Number two, you are sending this patient back to patient's family physician. Number three, anyone can tell me what else? What else? So, as we are writing back to family physician, it means that the physician already knows this patient, and we will skip all the information that the family physician already knows about this patient. Okay. Okay. Anyone has any questions so far? Any questions so far? Please mute. Please mute. So, any questions so far? Next, we are going to read the case notes. Okay. This is today's date, and you are a doctor or nurse at this hospital. Read the case notes and complete the task. Okay. Name of the patient is Daniela White, and you will get the title. Many of you are worried we're going to write Miss or Mrs. whatever or Mister. So you will get in the real exam in the bracket. Okay. So you will write for this patient Miss Daniela White. Okay. is female, date of birth is given, age is given. So if both date of birth or age given, so what we will write in the greeting part?
Date of birth.
So you can write both of them, but I prefer the age, okay? Because you can quickly know how old this patient is. You can write both of the one of them, okay? Date of birth or age, both of them are okay, but I prefer the age, okay? This is social background of the patient. She is married, she lives with children and one daughter, one son, and she worked as architect at this institute, and the hobby is painting and camping. Okay, this is social background of the patient. In the past medical history, she smokes and drinks, allergy, no known allergies, and she had chicken pox at the age of 3 and was treated with antiviral, a chronic sinusitis, and she has regular follow-ups with ENT specialist, and she got vaccination status. Her vaccination status is her last dose of tetanus vaccine was 1 year ago. This is tetanus vaccine history. Family, father is diabetic, mother is hypertensive and has gout, and then the main issue of this patient starts. On this date, on 10th of 11, 2020, this is the real date when I have written this letter, okay? These case notes in 2022, so almost 2 years ago. So I wrote these case notes. So in the real exam, you will get today's date would be the same as exam date, okay? So on this date, what happened at 10 in the morning, snake bite on right foot. So I'm not writing complete sentence because these are the notes. Just snake bite on her right foot. And can you hear me well? Can you hear me?
Yes, sir.
Okay. And patient was camping in desert and there was severe pain and bleeding at the wound site, and she called 911, the emergency number, and she was rescued by air ambulance as there was no road access. Then the first aid was given by a tour guide. What this first aid includes, they have removed hiking shoes and socks, and they washed the wound, the bite site with water and soap. Then this is just my discount offer. And they also covered the wound with clean and dry dressing. So this is first aid that was given by a tour guide. Okay, at 10:30 in the morning, so after half an hour, the air ambulance arrived, and when they arrived at the bite side, there was redness, there was swelling, there was bruising, there was severe pain and tenderness, signs of infection. Patient was having labored breathing and disturbed vision, and her examination showed saturation this, blood pressure this, temperature this, and pulse this. And there was weak pulse and there was decreased knee reflex, okay, in an infected leg side, okay. On assessment, it was neurogenic shock, and the reason was why this is question mark here with neurogenic shock. Why there is question mark with neurogenic shock? Can anybody tell me
Sir,
why?
not properly diagnosed.
So
Sir,
we
it's
cannot say
not
not
properly
properly
diagnosed
diagnosed.
as
No,
far.
this wording is not good. Not properly diagnosed. This is possible diagnosis, most likely diagnosis. Possible, okay. With question mark is most likely possible
Okay,
diagnosis.
sir.
And the reason for this shock is
Okay, sir.
snake bite, okay. And this is the treatment that was given at that time, okay, when the air ambulance arrived. Then after half an hour, the patient reached at this hospital. The pain was decreased. There was no bleeding. And what is this? Tingling in right foot. Range of motion, ROM is range of motion of right knee was decreased. Right knee reflex was absent and there was ptosis and slurred speech. This is the examination at that time. There were blisters and what is this here? On right foot and leg. Assessment at that time. This is no confirmed assessment. There is no question mark. Okay. Snake bite, then neurotoxic. Okay. Type of snake bite is neurotoxic. Okay. So the treatment at the hospital is given is this one. The treatment that was given at hospital is this one. Okay, morphine, antivenom, and a Hartmann solution, and vaccination. On this date, there was improvement, and patient had no fever or vomiting. And about wound, there was no redness, bleeding, swelling, or discharge. And vitals were normal, examination was normal, neurological examination and range of motion was normal. And this is the discharge. So this is the discharge, and this is the date. So this is same date you are going to discharge the patient, 24th. Okay. Monitor vital signs. So this is discharge plan. So why this is plan? For whom you are writing this plan? For whom you are writing this plan?
Physician of physician of the patient.
Physician of this patient. So the physician, family physician will monitor signs of infection, and they will do daily neurological examination. They will daily do dressing of this patient for the next 5 days. Okay, this is the plan for the physician, GP. Okay. After this is the task. Okay. So now you have read your letter, and you know how many visits are there and what information is there. Now it's time to plan your letter. Okay, so how you will plan? Is discharge letter, how we will write chronological order, order of importance? Which type of this letter is discharge letter? Yeah, we will write in chronological order, order of importance. Do you know what is chronological order, order of importance? Order of importance is when you write the most important visit first. That is mostly today's visit, and then you write initial visit. That is mostly for urgent letters. For discharge letter, for non-urgent letters, we mostly follow chronological order. In chronological order, you will write initial visit first, then next visit, and then conclusion like this. Okay. So here in this letter, we will follow chronological order. Okay. So in chronological order, we will first have purpose. After purpose, you need to see how many visits you have there. Okay. And how you will organize. First, you have 20th of November 2022. Okay. This date. And in this date, there are three visits, mean three timings are given. And then your 24th discharge date. Okay. If you only write two dates, 20, all the events that happened in 20th of November, like this. So all things, all events. Okay. And then 24th, 11, 12 is today's visit and discharge. Okay. And do you think in this letter, all this information that is given, father has diabetes, mother has hypertension, and patient had chicken pox, chronic sinusitis, tetanus vaccination, smoking, drinking, allergies, and lives with children and works in this institute and hobbies. All these things are important or not?
No, sir, not
Why?
important to mention because we are writing this letter to the GP of the patient. So there is no need
Yes,
to
you are writing
mention
this
these things.
patient GP to the GP of this patient. They already know about this. Another thing is, patient was bitten by a snake. Is it important to mention these things for a snake bite and for the treatment of snake bite?
No, sir.
No, okay, there is no need, okay. So if any of you writes a paragraph about social history of this patient, past medical history, you will clearly fail your exam, okay?
Sir, and what about the last dose of tetanus vaccine?
Is okay, you can mention, but a patient was already treated.
Okay, sir.
They have treated it because they have given tetanus dose, tetanus vaccine in the if you see during hospitalization, you will see somewhere is given. Okay, booster dose of tetanus was given because the last dose was more than 10 years ago. Okay, so it's already treated, so it's also not important. Okay, is GP going to give any booster dose for tetanus? No. Okay, it is already given, so there is no need to mention this also. So if any of you writes anything about the past history, social history in your letter, you will get low score. If you are doctor, you will get C plus. If you are nurse, you will get C. Okay. So we are not going to write anything about social history. We are not going to write anything about past medical history. So we have only two dates, 20 and 24th. 24th is discharge date, today's date. Then we have 20 of November. So one date. Okay. If you write all these three events in one paragraph, do you think your letter will be good in organization or paragraphing? Yes or no? Can anybody discuss with me anything so you can learn, please? So how you are
First,
going to
we write
organize? Yes, please. How you are going to organize your letter?
first in the 20 November, patient came with a complaint and how to manage how examination finding. And then second paragraph, 24 for the discharge plan and patient condition and discharge plan.
So my question is how you will organize your paragraphs? How many paragraphs you will write in your letter?
Purpose and
Yeah.
initial paragraph, second paragraph for discharge plan paragraph.
Anyone else? Anyone else?
Sir, purpose,
Yeah,
initial
purpose.
initial visit and the recent condition of the patient and the discharge plan and conclusion.
So you are saying is purpose, initial visit, okay. Then today's visit or discharge, and then conclusion, four paragraphs, yeah.
Yes,
And you will not write any social history or past medical history, yes or no?
sir. We will not write.
Good, very good, okay. Do you think if you organize your letter like this, you will get B or C plus if you are Doctor B or if you are nurse C plus? If you organize your letter like this, anyone? No? Okay. No, my question is if you have this date and you have all of these things happening at 10 in the morning, all of these things plus this also at 10 in the morning. Then after half an hour, you have all of these things happening to the patient in the next half an hour, after half an hour. Then again after half an hour, when you reach the at the hospital, you are having all of these things happening to the patient. Okay, you will mention these to the GP. Okay, if you mention all of these things in one paragraph, do you think you are having good organization of your letter, good paragraphing?
I
No, sir.
believe it has to be in two paragraphs. One, the things that have been done on the way, and the things that have been done in the hospital.
Uh, so it is very easy. Just divide it into three. Okay, what happened at 10 in the morning? What happened at 10:30 in the morning? Okay, and what happened at 11 in the morning. Okay, then write today's visit discharge plan and write the conclusion. Okay, even
But I
you can
I have
add.
a question,
Yes,
please.
please.
Does the GP need to know everything that has happened for the patient, including the first aid and everything that has been going on in the hospital?
Yes, briefly. This is a discharge letter.
Briefly.
We cannot just say, okay, this patient was bitten by a snake and now he is stable, and we are sending this patient to home. Just do his dressing daily and whatever it is written. Okay, so just do these things. Okay, do dressing, monitor for infection, and do daily dressing. Do neural examination. No, no, this is not a
Uh,
discharge
I
plan. Okay.
I mean the provisional diagnosis and then
Yeah, each and everything,
the yes,
each and
yes, okay.
everything, but briefly. Briefly, okay? So you are going to write all of these things in from in within your word count limit, okay? In 180 to 220. Just imagine, just imagine you don't have these case notes with you, okay? Just imagine you don't have these case notes with you, okay? I am sending this patient to you, or you are sending this patient to me, and we don't have these case notes. We don't know anything about the patient, what happened, and how he was admitted. So, how you're going to tell me about all the things about the patient, important things? But writing a letter and telling me each and every important thing about the patient, okay, briefly, concisely. This is the purpose of teaching you in OET to write letters, okay, so that you can, when you're writing this letter to another doctor, even in the real life, you write letters, okay. So you should be very concise and to the point and mention all important things, okay. Good. Any questions so far? Any questions so far?
No, sir.
No. Okay, good. So now we are going to start writing our letter. Okay. So we will organize in this way. Okay. Purpose and all of these things. Okay. So first of all, purpose. What do you need to write in the purpose? In purpose. What do you need to write in the purpose? Two things. Number one, diagnosis of the
Condition of
patient,
the patient.
condition of the patient, diagnosis, the main issue. And number two,
What we want from the writer to do with
what
the
we
patient.
want from the writer. Okay. From the reader for this patient. Okay, so we need to write these two. It's very easy to write a purpose. Okay, number one, what is the main issue of this patient? Yeah, and what you want from the reader. Why you are writing this letter to the reader? Okay, and I have marked thousands of letter, and when your purpose is not good, you miss one of these things. I laugh like this. Okay, okay, good. So if you are doctor, you're going to get C plus. So if you're a nurse, going to get C because you don't know how to write the purpose. What I'm going to see in your body paragraphs, even if you don't know the purpose. And even according to criteria, if you don't get 2 out of 3 in purpose, you will not get B grade, even if your rest of the letter is very good. Okay, so purpose is very important. So you're sending this patient back. So we will start like this. I am writing to update you on then name of the patient. Okay. What is the name? Miss Daniela White. So we're going to write Miss Daniela White or only short name. Okay. Surname. What you're going to write? Miss White or Miss
Miss
Daniela?
White.
Miss
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 White.
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 Use surname. Okay. So I'm writing to update you on Miss White. Okay. Now you are going to write the issue of the patient. Okay.
Are we going to write the age?
Mostly in nursing letters, they write the complete name in the purpose and then they write surname in nursing letters. But it's okay if you use surname from the start. Is no mostly we see this. Okay. Okay. Then issue of the patient. Okay.
Are we going to write the age here?
You can write, it's optional, okay? Let us skip it, okay? Just write the main issue of the patient.
How much?
So what is the main diagnosis?
Neurogenic shock due to snake
It
bite.
was here at this time, but if you see in the discharge plan, this is no in the after this you have made this assessment, okay? So do you think this assessment is more accurate or this assessment is more accurate?
The last one.
The second, yeah, the last one
This
should be
one,
more.
this one, okay?
After the assessment,
Snake
yeah.
bite.
So how you're going to write like this snake bite and then in the bracket neurotoxic?
No,
So just who has a diagnosis of snake bite neurotoxic, okay? Do you think this looks good?
no,
So what you are going to? Oh,
neurotoxic snake bites.
neurotoxic snake bite, okay? What else? How are you going to write a good sentence?
His
Possible.
clinical signs and symptoms secondary due to the neurotoxic
Yes, and
snake
symptoms
bite.
secondary to neurotoxic
Suggestive
snake
of
bite
probable diagnosis.
is not
Probable
suggestive
diagnosis
here
of the
because this is final diagnosis. Suggestive is when there is question
probable
mark.
diagnosis.
Is probable, suggestive is the same. What else? Anybody else?
Here is a question mark, so we can
Yeah.
write down, I think, for likely diagnosis of the snake bite
No,
leading
there
to
is no
neurotoxic
question
shock.
mark. There is no question mark here. The question mark was when the patient came at the start. Even not came when patient was rescued by air ambulance. At that time, patient was in neurogenic shock. Okay, but patient when came to the hospital, this is the final diagnosis that they have made. So there is no question mark here. This is the final diagnosis.
Yeah. Okay. Can you say with suspected neurogenic shock
There
has
is
a
no
diagnosis of
need to
snake bite?
mention. There is no need to mention
No need.
neurogenic shock. Just
Okay.
leave it. Okay. Just mention
Okay.
snake bite or neurotoxic snake bite. Okay.
Okay. All right.
You can write whose signs and symptoms are consistent with neurotoxic snake bite. You can write whose features are consistent with neurotoxic snake bite. Okay. But as this is discharge letter, the diagnosis is already made and patients are already treated. I mostly like another way. I mostly like another way. Can anybody tell me what I like here? Mostly whose sign and symptoms suggestive of whose sign and symptoms are consistent with this type of language mostly we write when we are for referral letters when you are sending this patient to another doctor specialist, okay, for the treatment, and this is discharge
Sir,
letter
who is ready to discharge back into your care?
is in the second sentence, not in the first sentence.
I have a
I
question, sir.
prefer I prefer here who has
Sir,
been treated for
Sometimes older children, they might say things that are very negative or self-derogatory.
sir, we can say that who has a diagnosed case of snake bite.
does not look very good. Okay, this language is for body paragraphs, not for purpose. Okay, who has been treated for neurotoxic snake bite. Okay, who has been treated. Okay, in the hospital. Any issue here?
Sir, got it, sir. Thank you.
So any mistake in the sentence? There is one mistake in the letter in this sentence. So can anybody pick and write in the chat what is the mistake, please, in the chat? There is one mistake, big mistake, not small mistake, big mistake.
Neurotoxic with capital letters.
No need of neurotoxic. Someone is saying, so neurotoxic should be with small, yeah? You are saying this. Okay. Now it is okay?
Yeah. Also, snake bite shouldn't be
Why?
capital.
Why? What is the reason?
It's not nouns.
Is not?
It's not names.
Is not names? What do you mean?
I don't believe this should start with capital
I agree
letters.
with you. I agree with you, but we need some logic.
Uh,
It's not a new sentence, so it can't start with capital letter S. There's no
Very
full
good.
stop there. So,
Very
yeah.
good. Excellent. So we need to know why she is saying neurotoxic snake bite should be in small, not in capital letters. What is the reason? None of you know? How you were right about diabetes? Who has been treated for diabetes mellitus? How you were right?
Small letter, sir,
Why?
because it is the name of the disease.
Name of the disease, okay? And
Yeah.
snake bite is not the name of the disease, yeah? People is very easy, okay? Let us not waste your time, okay? If the name of a disease is a common name like pneumonia, like diabetes mellitus, okay? So these names are written in small. We only write the name of a disease in capital if the name of a disease is given after someone's name. Can you give any example?
Parkinson disease,
Parkinson's disease, Down syndrome,
Alzheimer.
Alzheimer disease, okay? Like this.
Guillain-Barré.
Yeah. So even in that case, the syndrome, the disease will be in small. Only Alzheimer, Down, okay, Parkinson, these would be in capital, the first word, okay, the first digit. Okay, so we will make it small. Very good. Okay, no, is okay. Who has been treated for neurotoxic snake bite? What else you are going to write here? He or she is she. Okay. She is being discharged today. And what we need? What do we need from the reader?
Follow up.
Further
Further
care and
care.
follow up.
Care and
So
follow
Yeah,
up.
further
further care.
care and
Yeah.
follow up almost the
Okay.
same things. Just write one of them. Don't write both of them. Okay. She's being discharged today, and you are follow up care or further care. You can write both of them. Okay. One of them. Okay. Your further care would be highly. Why I'm using this language? Because this is polite language and looks very good. Okay. Polite language, good language. Okay. Formal, polite language. Okay. So now this is your purpose. Okay. She is being discharged today, and your further care would be highly appreciated. Very good. Okay. Now, on this date, further care and management is mostly for refer letters. Someone is saying in the chat. Okay. Sorry. So now let us go to the this what happened at 10 in the morning. Just to tell you that normally I have been charging £5 per letter feedback. Okay. So as maybe some of you have already joined my course, but nowadays as I have started after a long time, after some days of break, I have started classes again, so I am giving some discount. For written feedback, it's just £4 per letter. And for online feedback on Zoom, like this, okay? So you will send me your letter, you will get feedback one-to-one feedback, okay, individual feedback, just 2.5 pounds per letter. And if it is offline feedback, means you will get a model answer, you will get voice notes, you will get all the explanation in just 2 pounds per letter, okay. So what happened at 10 in the morning? So snake bite on right foot, camping in the desert, severe pain, bleeding, 911 call, air ambulance, no road access, first aid by tour guide, removes hiking shoes and socks, wash bite site with soap and water, okay? And what else? Covers with clean and dry dressing. So now you're going to convert these things in one paragraph. It looks very easy, but it's difficult to convert them in one paragraph, okay? Let's try that, okay? So on this date, on 2011, 2022, you can just write 22 also. On 10 a.m., you can write 10.00 also. So you will use name of the patient, Miss White. So no, I have not given you complete sentences. I just give you snake bite, okay? Camping in desert, severe pain, bleeding, okay? So you are going to make them sentences. So how you can make a sentence? Can anybody try? Just try to make a sentence here. Can you try to make a sentence?
Miss, sorry, Miss White, while she was camping in the desert,
Mm-hmm.
uh, she was bitten by a snake,
Mm-hmm.
and then she felt severe pain and bleeding at the wound site.
Mm-hmm. Good. What else
Uh,
you're going to write?
uh, the tour guide had called the ambulance, and he provided the first aid. Uh, he he
Yes.
he helped her with the first aid, including removal of the shoes and socks,
Mm-hmm.
washing the bite with water. I don't see, and soap.
And soap, yeah.
Yes.
What else? This was also
Uh,
done.
and also the wound was covered. He covered the wound with a clean, dry dressing.
Very good, excellent. Okay. So this is what you are going to write. Okay. Excellent. Okay. So you are making passive voice. Very good. You are not going to write active. Sorry. You're not going to write present tense here. Okay. You are going to write passive voice. Okay. Past tense here is good. So you have used good, uh, you know, language. Miss White was bitten by a snake while camping in a desert. Okay. Just full stop here. Don't write too long letter, too long sentences. Okay. She she had severe pain and bleeding just at her wound side or from her wound side. Okay. Um, just write a passive as okay. Air ambulance. Ambulance would be small. Okay. Air ambulance was called as there was no access by road, okay? Our tour guide provided her first aid by removing her hiking shoes and socks and okay, like this, okay. He also just 1 minute. Okay, so he also washed her bite side with water and soap. And what is the last thing?
Covered with dry and clean dressing.
Just we can continue here. And just write a good sentence because you're not going to write very short sentences also, okay? So join this information together and covered her wound site with clean and dry dressing, okay? Clean and dry dressing, okay? Good. How many words we have here? 71, okay? And how many words we have in purpose? And in total we have 100 words, okay? Can you hear me?
Yes.
How many words we have here?
100 Roy.
101 words, okay? Just
Yes.
in purpose and in initial visit. So in conclusion, you will almost have there are 30 words, almost 25 words you will have. In light of the above, I would be grateful if you could do and this, that for the patient, okay? So in conclusion, you will have 25 words, okay? So 101 plus 25 in total, so far you have written 126 words, okay? How many words are remaining? Just let us take average, okay? You can write between 180 to 220 and just like take average of 200 words, okay? So 200 minus 126 is equal to how many words? 74, okay?
74.
74 words, okay? So 74 words. So how many things you are still have to write in this letter? So you have to write all these things that happen at 10:30 a.m. in the morning: treatment, examination, okay, labor breathing, disturbed vision, all of these, sign and symptoms. Okay, this examination is important. This is the diagnosis. Okay, neurogenic shock. Okay, the treatment. Then you are going to write about what happened at 10 in the morning in the hospital. Okay, at 11 in the morning at hospital. What was the condition? What treatment was given? And you're going to write discharge plan also. Discharge plan. So how is the patient condition today, and what the reader is going to do for this patient after discharge? Do you think if you have written 100 and 126 words, you can cover all of these things in 74 words?
No, sir.
No, okay,
It's not possible.
it's not possible. I know this grammatically and English wise, this is good, okay? There, the paragraph that you have written of 71 words is good. English wise is good. You okay? So there's no problem with your English, your grammar, your type of sentences, okay, is good, is well organized. But this is too long. So how you're going to make it concise? This is difference between B grade and C plus grade. How you're going to make it concise? And mostly nurses struggle with this, okay?
Can we just say that first aid was provided, full stop?
Very good, excellent. Who is there?
Me.
Is you, but your name.
Amira,
Okay, very good. Okay, you're a
Sir,
doctor or
there is no
nurse?
need.
a doctor.
Doctors, okay. When is your exam?
I haven't booked it yet.
Okay, so when you book your exam, one free OET writing feedback for you, okay? Not
Thank you
from
so
this
much.
letter, from other letters, okay? Okay, so you will send me one letter, I will give you detailed feedback. But this letter, you people, all of you can send me this letter and I will provide you feedback, okay? On your letters. So there was no need to write all of these details, but just you are writing to a doctor, not to someone layman, okay? There was no need to write all of these things about the first aid. Just first aid was given by tour guide, okay? That is enough.
Sir, sir, and there is no need to mention that there was no access by the road.
Yeah, very good, excellent. So you can skip this. You can just air ambulance was called. Even this you can skip because when you can mention briefly somewhere the ambulance, okay? So now I will show you what I have written in the model answer, okay? Just 39 words, okay? Almost half of what you have told me, okay? Can anyone read this for me, please? Just let me make it a little bit bigger. Any nurse? I would prefer one nurse who can read this for me. Yes, please. Can you read it? Can anyone read, please?
Okay.
Yeah.
Initially, on 20th 11, 2022, Mrs. White was bitten by a snake on her right foot at 10 a.m. while she was camping in a desert. She was provided first aid by her tour guide and was rescued by an air ambulance.
Okay. Is it well organized, concise, to the point? Yes or no?
Yes, sir.
Yes.
Now, a very important thing. I have made one mistake
Yes.
intentionally. What
Instead
is the
of on,
mistake?
it's supposed to be at 10 a.m., not
Yes.
on 10 a.m. Yeah.
Why?
At. That's the time.
With date we use on, but with time we use
How we
at,
use
okay?
at.
Add.
At.
Yes.
But do you think, does it look very good on this date, at this time, Miss White was beaten? Can you see how I have arranged it within the sentence instead of writing at the start?
Yeah.
Just look at these small things. Just imagine for OET, you don't need a lot of English knowledge, okay? Just you need to improve small things. Dr. Kausar, that she has given feedback, right, in this class. She got 322 times in the real exam. After joining my classes, she already got feedback from here and there, okay? I will not mention the names. After joining with me, she got 420, 100 marks improvement. So what was the reason? Just I taught her these small things. I marked a lot of letters for her. I gave her my own model answer. This is the difference between others teachers and me. I give my own model answers, okay? I also mark the letters individually, okay? So these are small things. So you can see how I have organized that, arranged the time at this time, okay, while she was doing this. So this is well good organization, okay. Now let's move to the next, okay. Sorry. Then we have this day, this visit. When the air ambulance arrived, what was the condition of the patient? What was given to the patient, okay. So air ambulance arrived. There's no need to mention air ambulance arrived, okay. Or you can mention briefly. At the bite side, you see redness. And when they came, they saw this, okay? Redness, swelling, bruising, severe pain, and redness, signs of infection, and labored breathing, disturbed vision, examination, O2 saturation is low, you will mention this. Blood pressure is low, you will mention this. Temperature is okay, you don't need to mention. Pulse is normal, you don't need to mention, okay? So what you will mention from examination? Saturation and blood pressure, okay? Weak pulse is important. Decreased knee reflex in the affected leg, in the right leg is important, okay? So this diagnosis you can mention briefly, and then in the treatment, you will not mention each and everything, just the main thing, okay? IV fluid, analgesic, and the wound was washed with normal saline and antiseptic solution, okay? Can anybody try to make some sentences just quickly? And just tell me what you are going to, how you're going to organize this paragraph. Just we're going to end the class soon, just this this visit and next visit, and then we will end the class, okay? So can anybody try to make some sentences for this visit? Dr. Christine, you can try, okay? Because your English is good.
Sir, we can write appropriate treatment was given
Yeah,
or
but for the
was
last,
provided.
I'm asking for the complete
Yeah.
visit. Okay? One thing possible is we can do at this time, air ambulance arrived and she had redness, swelling, bruising, severe pain, and redness on her bite side. Okay. Also,
Can we just write signs of infection on the bite side? We don't have to write in details what was the signs.
why?
Can just we are talking to the GP, so we can just write that she has signs of infection.
GP knows what are the signs of infection?
I think I
Yes.
mean he doesn't need, he knows, but he doesn't need to know what were the
He's a
signs
doctor.
exactly.
He's a doctor, but not doctor like me, okay? Who is teaching OET. Okay. Anyway, okay. So GP knows these things, okay? So why I'm writing this thing in the bracket? Just to help you, to make the your paragraph concise, okay? If you don't know this signal of bracket, you will write each and everything, redness, swelling, bruising, severe pain, and tenderness. And mostly nurses will write all of these things, and then your letter will be long and you will not get your required score, okay? So this was a hint to make it concise. Just write, she had signs of infection, labor breathing, and disturbed vision, okay? Or her vision was disturbed and disturbed vision, okay? Then write in the examination, our auto saturation was 88%, blood pressure was this, and she had weak pulse and decreased knee reflex in the affected leg, okay? Then neurogenic shock was suspected, and she was treated with analgesics, IV fluids, O2, and her wound was washed with normal saline and antiseptic solution, okay, like this. Okay, doctors and nurses also. So here I'm going to copy this. You will start with the time, okay? This is just like the date. Okay. Can anyone read this one for me? Dr. Amira or Nurse Amira?
Yes.
Yes, please.
So at 10:30 a.m., Miss White had signs of infection along with labored breathing and disturbed vision. Her BP and O2 saturation were low, and her right knee reflex was decreased. Neurogenic shock was suspected, and she was given morphine, IV fluid, and O2, and her wound was treated accordingly.
Yeah.
Dr.
You can
Che
just say
OET.
her wound was cleaned, okay?
Okay.
And cleaned with whatever it is mentioned, okay? Her wound was washed with normal saline and its antiseptic dressing was applied. You can do this, but just to make it concise, was treated accordingly. Okay, so just you can mention this also, it is not a problem. Okay, you can see how I have made it. There is no need to mention air ambulance again, and no need to mention all these names of signs of infection. No need to mention all of the redness, this and that. Okay, no need to mention temperature and pulse because they are normal. Okay, and there is no need to give all the details of the treatment. Just briefly explain them. Okay, no, this is what you have treated in the hospital. Okay, you will start with at this time, and then you have all of these things. If you write all of these things, imagine your paragraph would have more than will have more than
Yes.
100 words. Okay, easily, but you need to make it concise. Okay, let us read. Okay, okay. There's no need to mention the patient reached at DrChe hospital. Okay, there's no need to mention this is just my advertisement. Okay, pain decrease is important. No bleeding, you can skip. Okay, new symptom tingling in right foot is important. Okay, decreased range of motion of right knee is important. Okay, right knee reflex is absent is important. Ptosis and slurred speech is important. Okay, but how you are going to make a good sentence of all of these things is important, is the real magic that you will do. If you can write a good sentence of all of these things, it means you can get easily B grade in your OET writing. Okay, can anyone try to write a sentence or just think how you're going to write a sentence about all of these symptoms? Okay, this range of motion, can we take it in the examination instead of in the symptoms? Is also possible. Okay, knee reflex, can we take it in the examination instead of in the symptoms? Can you hear me? Can you hear me?
Yes, yes.
Yes, sir.
It's possible. Okay, knee reflex, it can be examination also. It can be symptom, it can be examination also. Range of motion can be examination also. But ptosis, slurred speech, this should come in the symptoms. Okay, out of examination, O2 saturation is okay, blood pressure is okay, pulse is okay, respiratory is okay. So we will skip all of these things. Okay, vitals. But there is something new. There are multiple blisters of 1 to 2 centimeter on right foot and leg. Okay, this is important. What we can do is these blisters and this reflex and this range of motion you can take as examination, and pain, tingling sensation, ptosis and slurred speech you can write as symptoms. Okay, let us see. Okay, what I have done here. Okay, so what I have done is, even you don't even mention over hospital, yes, was brought to hospital. Okay, at this time Miss White was brought to over hospital. You can skip over, just brought to hospital. You can write even the name of the hospital, DrChe hospital also. Okay, it's because you are the author of your letter, you can write anything. Okay, you can write your whatever the name of hospital. Okay, these are my own case notes, by the way. I cannot teach others case notes due to some issues. Okay, due to copyright and these things I get problems. Okay, so Mrs. White was brought to our hospital and her pain was decreased, but no, you can see if you were right, just her pain was decreased, she had tingling sensation. But what I'm doing now here, good thing and then bad thing, okay? So I am writing, joining them with but, okay? But is showing something opposite, okay? It's coming, okay? Do you think if you write like this, it would look good or not? Try to participate. I know you are tired because you have taken a long class, okay? So her pain was decreased. This is good thing, okay? But there are some bad things also. Pain is decreased, was decreased. You need to use past tense, okay? But she had something new.
Negative.
But she had a tingling sensation in her right foot, ptosis, and slurred speech. Okay. If you are a straightforward student, you will write like this. At this time, Miss White had decreased pain, tingling sensation, right foot, ptosis, and slurred speech. Like this, okay. I will show you. At 11 a.m., Miss White had decreased pain, tingling in right foot, ptosis, and slurred speech. Okay, this is straightforward. Okay, you have joined all of them things together. She had decreased pain, tingling sensation, tingling in right foot, ptosis, and slurred speech. Okay, this is straightforward, easy. Okay, so but just writing positive thing first and then negative things and joining them with but. No, I have improved to an advanced level in OET. Okay, this is not high level of English. Is this high level of English? Any difficult English, or I'm writing something complex? Yes or no?
No, sir.
I'm not
No.
writing anything complex. I'm just making it easy, good, okay, and making it easy for the reader to understand. So I'm saying that, okay, Dr. Che, you are GP. Let me tell you that when she came to hospital, her pain was decreased. That is good thing. Okay, signposting. But she had tingling sensation in the right foot and this leg in leg also. Ptosis and slurred speech. Now I am showing the neurotoxic symptoms. Okay, these are the neurotoxic symptoms. That is why my diagnosis is neurotoxic snake bite, not just snake bite. Okay, no examination. Her range of motion of right knee was decreased and the right knee reflex was absent. So this is in the
So
examination.
we can write ROM.
Yeah, RM is
We can
okay.
write
Yeah, RM is common term. You can write it. Okay. Okay. So what else? So what I have done is I have taken these blisters with the treatment, okay? Just to write a little bit better sentence, okay? She also had a blister of 1 to 2 centimeter and was given antivenom 40,000 units and a booster dose of tetanus was given. I mean, even I'm not writing analgesic, no, because her pain was decreased, okay? Analgesic is not too important. Important is antivenom and tetanus vaccine is more important. Yes or no?
Yes, sir.
Yes, sir.
Okay, good. Thank you. Now you have two things. You are going to write conclusion. You're going to write today's visit. Okay. This is your today's visit, 24th. Okay. And this is your discharge plan. Okay. Sometimes we write discharge plan before conclusion also. We write separate conclusion. But what I have done, I have written discharge in the discharge plan. I have written conclusion with discharge plan, and I have written today's visit. Okay. You can write another way also. Okay. So it's very easy. This 24th of I am having issue with my laptop also. On this, there is improvement, no fever, no vomiting, no redness. Wherever it is no, 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 just write her condition was improved, okay? And neurological examination, this examination, that examination, you can write that as her examination was unremarkable. It's very easy. Miss White's condition has improved today. Most of you write today at the start, okay? Today, Miss White's condition has improved. So what I have done is Miss White's condition has improved today, a little bit better way, okay? As her examination. So why it is improved? As her examination is unremarkable. Okay, examination is okay. And she has no signs of infection. Again, I am using conciseness. Again, all of these things are signs of infection. Now I'm saying no signs of infection. At the start, I was saying signs of infection, okay? And has no signs of infection, okay? So then the conclusion, what you need to write in the conclusion? Monitor signs of infection is important to mention. Daily neurological examination is important. Daily dressing is important for the next 5 days. But it's difficult to write a good sentence of all of these things, okay? When you write by yourself, you will note it's difficult to make them and to arrange them in a sentence, okay? So what I have done here is, I will show you. I would be grateful if you could monitor her signs of infection, okay? And do her neurological examination and daily dressing for the next 5 days, okay? Done? It looks very easy, yeah? But when you will write by yourself, it would not be easy, okay? Any question? Anyone has any question? Any question? You can ask me if you have any question. Do you have any question? Have you learned something in today's class or not?
Yes, sir.
Can anybody summarize what you have learned so far in today's class?
It's 226 words. It is
From
long.
180 to 220. In this range, you can write your letter. But you are not going to include irrelevant information to make it long, and you are not going to skip any important information to make it too short, okay? So between 180 to 220 is acceptable. Any other question? So this is
So
just, yes,
the
please.
number of words includes the name and the address and the date in the beginning of the
No,
letter.
no. Your word
Okay.
count starts from I am writing to
The
refer,
purpose.
from the purpose. I am writing to refer, and your word count ends at conclusion, okay? After conclusion, your word count ends. The last sentence that your word count will end here. This is your word count, okay? So we have, because I'm writing here DrChe OET, DrChe OET, these things. That is why the word count looks. So overall, the word count is, my word count is 226, okay? It's not a big issue, okay? 5, 6 words above. So the last sentence, if you have any further queries, please do not hesitate to contact me. This is not included in your word count, okay? Any other question?
Yeah, past history is not important in this.
In this letter is not totally irrelevant, not important. Any other question? Because the GP already knows about these things. And if patient, for example, if the mother is diabetic and the patient was bitten by a snake, what is nothing to do with snake bite? And for mother is hypertensive, nothing to do with that, okay? Patient has hobbies of this and that, painting and this and that. Nothing to do with patient's current condition of snake bite, okay? Any other question?
What if she has some chronic medical condition like hypertension or diabetes herself?
It will not
Would we
affect.
mention this to the GP
In
or he
here
already
in this
knows?
letter, no need. In this letter, no need,
Okay.
because this will not affect any treatment of the patient, okay? And the GP knows about these things. GP is already treating this. For example, if the patient was hypertensive, for example, if the patient had any neurological disease like Parkinson's disease, okay, that is that has to do with the nerves, okay, like myasthenia gravis, like this diseases. And due to this is neurotoxic snake bite, due to that, if you have changed some medication or this neurotoxic snake bite can affect, okay, overall the disease condition of that patient, then it is important to mention, okay? Otherwise, no. For
Sir,
if a patient is having treatment of Alzheimer disease, so due to snake bite, due to neurotoxic, neurotoxic shock, if you have changed the dose of medication of that patient that she was already taking, then it is important to mention. Yes, please. Any other question?
sir, I'm Dr. Rizwan,
Yes.
and I'm so thankful. This was my first session,
Thank you.
and I learned, and I wanted to give a little bit feedback.
Yes, please.
And first of all, you told us, Mike, and I has been corrected to me that you told that regarding that I am writing to update you on this fight that his or her clinical signs and symptoms consistent with, instead of writing like a suggestive or likely the word. So I'm impressed that one. Number
Thank
one.
you.
Second feedback regarding that one, you told us that. Instead of being for the follow-up care or the further care, these are the similar word you can write. And
Yeah.
you told us regarding the small points, right? The date and time on where to put the on and it.
Yeah.
So that impressed me. So these were the small points, and
Yeah.
how to make it short and summarize and active and passive voice instead of the present symptoms.
Yeah.
So I would be appreciated if you go for another session like reading, and probably I will take your this uh,
Yes. Well, I will. I will.
session.
I will. So tomorrow we will do speaking. So next class on Saturday we will do reading, and again on Monday we will do writing again. So we will rotate three modules. Okay, reading, writing,
Thank you so.
and speaking. Okay, listening I cannot do here
One,
because listening materials we
I
cannot
can
share here.
understand, sir.
Yeah.
But the problem is one of the reading part C. So yesterday I was missed,
Hmm.
and secondly, sir, I
I
wanted to
have
ask a
recorded that
question
class.
that.
I have recorded that class, and I will upload on my YouTube channel.
Okay, sir. Thank you,
Yesterday's
sir.
class and this one also.
Okay. Okay, sir. One important question here, that can we write uh, the past medical and relevant history if it is a patient is a hypertensive or diabetic or history of any surgical history, operative history in the follow-up, or is supposed to be in a discharge later in the last.
In this letter, no, because this letter is already too long. Okay. And this condition of the patient has nothing to do with any chronic condition. Okay. This is just an emergency that patient got a snake bite. And this letter is already long because you are having four visits. Okay. 10 a.m., 10:30,
Or
11 a.m.
suppose sometimes it has been written that the patient is alcoholic or
Yes,
smoker.
sometimes is
So,
even in discharge letter, sometimes we write these things when it is important or is, almost important. Yes. There's no fixed rule in OET. So they're flexible about these things. Okay.
or sometimes already the patient is taking the drugs like warfarin or ADC that may interact with these snake bites,
Yeah.
so coagulopathies
So,
as in a medically.
yes,
So
this is,
is
yeah,
it
what you need
this
to
is I
decide
think
at the
significant.
spot. Yeah. This is what you need to decide at the spot. Okay. They will not make it too difficult for you. Okay. Just imagine. In the real exam, they will not make your life difficult. Just you need to practice these letters that are already in the market. Okay. Practice these letters. You will get some, any letter similar to that. And you just need to know how to make things concise, how to organize the paragraphs, how to make things easy and clear for the reader. Okay. Don't make your life difficult and thinking and imagining. Okay. So this could be relevant and this could be this. Don't overthink. Okay. Just make things easy and simple in OET. Okay. It's not a difficult exam.
It's all right. Got it, sir. Thank you so much, sir, once
Okay.
again.
Thank you so much, all of you. If anyone needs any
Sir,
individual feedback, so written feedback is 4
sir,
pounds and online feedback on Zoom live with me is just 2.5 per letter, and offline is just 2 pounds. I used to charge a lot because A lot, no, because as you know, it takes a lot of time, and I have been teaching OET since 2020, is long time, so I cannot compare myself with other new teachers, okay? So, but nowadays I have a discount, okay? So thank you so much. Tomorrow we will do
Sir,
speaking, okay? Thank you so much, all of you. Any questions? Someone is saying something? Yeah.
uh, sir, the all the time mentioned 10, 10:30, 11 a.m. Sir, it is important, or we should conclude in only one paragraph of that visit.
Yeah, it
We have
depends.
made three paragraphs from that on that day, 10, 10:30, and 11. Is that important, or we can summarize in only in one paragraph?
Yeah, for example, if the same letter, I will tell you, if in the same letter I write what happened at 10 a.m., 10:30 a.m., and 11 a.m. After that, if I give you, for example, two more visits, for example, on 22nd of November, this happened to the patient. He was taken to the ICU. He was intubated, and he was given oxygen. He was given, this and that, and his saturation was low. And on 23rd, he was put off ventilator, and he was shifted to the respiratory unit. He was given oxygen there. He was given antibiotics. He was given this and that, and on today 24th, his condition has improved and he is being discharged. No, your letter has become long. You have 10 a.m., 10:30 a.m., 11 a.m. Then what happened to the patient on 22nd, 21st, okay, is important. What happened on 22nd is important, okay. So what you can do is all these 10 a.m., 10 a.m., 10:30 a.m., 11 a.m., you can write them in one paragraph, just concisely, important things. Then you will write what happened on 21st, then what happened on 22nd, and then what is patient's condition today. So you need to decide things according to the situation, okay? There is no fixed rule in OET.
Yes.
Do you understand, doctor, what I mean?
Yes, sir. Sir, 21st पे the visit, there is no visit mentioned in on 21st.
Just I am saying,
So how can we write?
just I am saying, if in the same case
Yes,
notes,
sir.
if in the same case notes, I make it a little bit more complicated.
Mhm.
I write all of these things that are mentioned in these case notes, plus I tell you that this is what happened. This is the 2020, okay? This was 20 of November. On the next day, on 21st, patient condition deteriorated. He was shifted to the ICU. He was intubated. His saturation was 50%. He was given oxygen. Okay. He was given antibiotics. He was given other things. Okay. He was given adrenaline. He was given this and that. Okay. And he was given 1 pint of blood due to severe bleeding, this and that. Okay. On the next day, his condition improved. He was shifted to the ward, okay? But still his saturation was low. He was given oxygen. He was given this. He was given that. He was given his immunization was low. He was given, immunoglobulins, this and that, okay? And on the next day, his condition improved. Today he's being discharged. Now I make it more complicated. Two more visits, okay? And these visits are important.
Mhm.
Yes or no? No, with
Yes, sir.
these
Yes.
two additional visits, you cannot write 10 a.m. separately, 11 a.m. separately, 10:30 a.m. separately. Okay.
Mhm.
So what you can do is all of
Yes.
things that happen on 20 of November at the first day, you will write them in one paragraph concisely and only important things. Okay. Then you will write what happened on
Mhm.
21st and then on 22nd and then what happened on today. So you will change your strategy according to the situation.
Yes.
Okay, thank you so much, all of you. So class is already too long. So tomorrow we will do speaking. It would be a good class also. Live feedback with me. So you can prepare yourself if anyone wants to participate with video. Okay, I will provide feedback
Sir,
for doctors and
one
nurses
important
also.
thing.
Yes,
Sir, one
please.
important. Can you please share the video or your YouTube channel so we can subscribe and that it will be easy access for yesterday that you took a class of reading.
Yeah. I will share a
Kindly
link.
share the link of
Yes, I will
YouTube.
share link. All of things. Okay, just join my WhatsApp, community. So in which I will share the link and I will share, uh, you know. And if anyone wants to participate, you can text me. I
Thank you,
will give
sir.
you the chance, okay, to participate. And you will do role play. You will be the
Thank you,
doctor.
sir.
I will be the
Thank you.
patient. And after doing the role play, I will provide feedback, okay.
Okay,
Thank you
sir.
so
Thank
much,
you, sir.
all of you. Thank you.